Good afternoon, Mrs. H. My name is Carrie Liebing. I'm a student at the University of St. Francis. I'm going to be doing your postpartum check today. We like to call it the bubble H. I'm just going to go ahead and take a look at your ID band and make sure that you're the patient that I think you are. Rosa Hernandez, 71384. Very good. The first thing I'm going to do is the B, which stands for breasts. So I'm just going to lift up your gown if that's alright.
Yeah, that's fine.
Alright, I'm just going to palpate with my fingers here or touch and feel for any warmth or lumps. Are you having any pain while I do that?
No, it's okay.
Alright, I'm also going to feel up here to the armpit to make sure that the milk duct isn't blocked, okay?
Okay.
I'm going to do the same over here. Are you having any pain?
Nope, it's fine.
Okay, good. And again up to the armpit.
Yep, it's
and I
fine.
don't feel anything, so that's good. I would go ahead and assess and say that your breasts are soft and your nipples are intact, okay?
Okay, good.
The U in bubble H stands for uterus. So I'm just going to lift your gown up here. We like to feel for the uterus right here on the belly, above the belly button. We'll usually feel where that is. So it's about 1 or 2 finger breadths from the belly button. It's nice and firm, so that's good. We want it to be firm like a basketball and not boggy or soft like a Nerf ball. So that's good. Have you ever felt for your uterus before?
No, I don't think so.
Alright, the only thing you need to do is just feel right here above. Your belly button is usually where it would be after you give birth. We like to tell you to do a fundal massage for 1 minute every day, okay?
Okay.
So you just do that and don't bear down too much because that's not, we don't want to do that. You don't need to press too far down. You just a little bit of massage for just 1 minute, alright?
Okay. Thank you.
You're welcome. The next B is, the next letter is B and it's for bowel. So I'm gonna go ahead and assess your bowel sounds with my stethoscope. I'm just gonna be listening for any normal bowel sounds such as clicks or gurgles, okay?
Okay.
And I'm gonna check in all 4 quadrants. Okay, that's good. So I would say that your bowel sounds are present and they're active, okay? They're not overactive or underactive. Have you had a bowel movement yet?
No, I don't think. I'm kind of scared to go.
Yeah, that's understandable. After you give birth, it's a little bit scary sometimes. But it's normal that you haven't had a bowel movement yet. Normally we don't see that for about 1 to 2 days after you give birth. If you want to ambulate or walk around, that'll help. That'll help you a little bit, and if you drink a little bit more, that'll help as well, okay?
Okay. Thank you.
You're welcome. The next thing that we're going to check for is your bladder. So we just like to feel right above the pubis symphysis right here. And when was the last time you voided?
Not too long ago.
Okay, that's good. We want to make sure that you keep your bladder empty so that your uterus doesn't distend, okay? Or move up. We call that subinvolution. When I press on this, does it hurt or make you feel like you have to use the restroom?
No, not really. I think it's because I just went.
Okay, that's good. So you just want to make sure you go every 2 hours, okay?
Okay.
Even if you don't feel like you have to go.
Okay.
The next thing we're going to check for is the L, which means lochia, which I'm going to just look in your pad here. Lochia is bleeding, okay? Alright, it looks like we have about an average amount of bleeding 4 inches. It's bright red, which we expect after birth, okay? There's no odor, so that's good. It'll be bright red for about 3 to 5 days after you give birth, and that's what we like to call lochia rubra. Next after that is going to be serosa, and that's going to be like a pinkish brownish color, and that'll be like about up to day 10. And after that is alba, and that's a white yellowish. And that shouldn't last too long though, okay? But we want to make sure that there's never an odor, and that you check your pad, and if you fill an entire pad in 1 hour, then you need to call a physician, okay, once you get home, okay?
Okay.
And we want to also make sure that you don't have any odor, or what was I gonna say?
Squirting. Like squirting when you push down.
Oh yeah. When we push on the belly, we want to make sure there's no squirting when we push on that, okay?
Okay.
Next is an E, and that stands for episiotomy. So we're just gonna go ahead and take a look at your bottom, if that's okay.
Mhm.
We're just gonna put your hand over your chest and just help me roll over here, okay?
Okay.
Alright, I'm just gonna lift this up and look in your pad. Alright, I'm just checking your episiotomy with Rita, and so there's no redness, no edema or swelling, no bruising, it doesn't look like there's any discharge, and the lines are pretty smooth and straight, so that's good. We like to see that with your episiotomy, okay?
Mhm.
Also, we always like to look at your epidural site. Make sure there's no warmth, no bleeding, no scabbing. So it looks pretty good to me.
Okay.
So we'll put that. Pull your dress back down. You can roll back over. All right, next, we're gonna check the reflexes. So I'm just gonna move on down here, okay?
Okay.
This is called the Holman's reflex, is the first one I'm going to do. We're gonna lift your leg up at the knee here, alright?
Okay.
Set your foot on the bed for a second. I'm gonna just feel for any warmth, any swelling or edema. Make sure there's no red streaks while I'm doing the check. So I'm gonna just go ahead and lift this a little bit, and we're gonna do a slow dorsiflex, okay?
Okay.
Good. And are you having any pain?
Nope.
Alright, that's good. Next we're gonna do the clonus reflex, which is just a quick dorsiflex. Okay, so I'm just gonna do that and let it pop down. Very good. The first reflex, we like to do that one for blood clots, which we don't expect you to have that, but we always like to make sure, okay?
Okay.
So we're gonna check this one as well. Just lift at the knee here, place the heel on the bed, and a quick dorsiflex and let it fall. Did you have any pain?
No.
Okay, that's good. So we're gonna do the other one, which is clonus, and we're just gonna do a quick dorsiflex and let your foot plop, okay?
Okay.
Alright, that looks really good.
Mhm.
I'm gonna go ahead and check this leg as well for any swelling, any warmth. We also like to look for the red streaks, make sure that there's no clot, okay?
Okay.
So it's looking really good. Your legs look nice. While I'm down here, I'm gonna go ahead and take this sock off here and look and see. Look at your toes. I just like to check for any edema. It looks like it has went down, which is really good for a day after birth. So that's good.
Good.
Put that sock back on, and I'll check the other one. Alright, I'm just gonna palpate the foot, make sure you have some good circulation, make sure there's no edema as well, and it looks really good.
Okay, thank you.
You're welcome. Now we're just gonna go over a little bit of teaching and see what you've learned. After you go home, do you know what kind of bleeding or located that you'll have?
Yeah, you kind of told me.
So it's gonna be a little bit red and all that, okay?
Okay.
And you wanna make sure that you change your pad, and you make sure that there's no excessive bleeding down there, okay? And no foul odor. We wanna make sure that you don't have that. So if you need anything, you can always call us, okay? Do you have any questions?
No, thank you.
Alright, thank you.
Thanks.